What is the definition of osteoporosis? Osteoporosis means bones that are porous, which translates to weak bones, bones that are thin, and they break easily. How common is osteoporosis? It is very common. Roughly speaking, 10 million Americans have osteoporosis and 34 million have low bone mineral density at the hip. 1 in 3 women over the age of 50 will experience an osteoporotic fracture, and also 1 in 5 men will experience an osteoporotic fracture as well. How do you know you have osteoporosis? We know that osteoporosis does not cause symptoms. It's a silent disease, and the only symptom people will have is when they break a bone and from the pain associated with it. Why do we need to know that we have osteoporosis? Is mainly to prevent fractures. And the fractures carries multiple comorbidities with it, such as disability and pain. How do you know you have osteoporosis? Is by a simple form of X-ray called DXA, or dual energy X-ray absorptiometry, that measure the bone density. It's a non-invasive test, very quick, and has low radiation. It measures the bone density of certain areas, such as the spine, hip, and forearm, and it compares your bone density with your peers by reporting something called T-score. A T-score comes in a negative range, and it compares your bone density with an average person who reached their peak bone mass between the ages of 20 and 30. Also, there is a report of a Z-score that compares your bone density with your peers, same age and same sex. T-score comes in a negative range. Anything more than -1 is considered normal bone density. The numbers between -1 and -2.5 represent low bone density or osteopenia. The definition of osteoporosis is when the T-score is less than -2.5. The lower the number, the more severe the osteoporosis is. Of course, it's important to know if you have a history of fragility fracture, such as falling from a standing height and breaking a bone, you do have osteoporosis despite normal bone density or bone density showing osteopenia. With the DXA, we do have another technique called a trabecular bone score, or TBS, that measures the architecture of the bone and tells us more about the quality of the bone by using the spine DXA.